A new report out says Ontario's healthcare system faces a bumpy road in the years ahead. Data from the province's Financial Accountability Office shows the government's spending promises fall billions of dollars short of what's needed to address issues like hospital capacity and staffing needs. Megan Fitzpatrick has more from the provincial legislature.
The Financial Accountability Office is looking at the government spending plan on healthcare up until 2027-2028. And its key finding is that the province is not currently allocating enough money to support existing healthcare program spending, plus fund all the commitments that the government's making to expand the number of hospital beds, for example, and long-term care beds. They're predicting a shortfall in the neighborhood of about $21.3 billion by 2027-2028. And the report does look at a number of key areas of healthcare spending. For example, the government's plan to add thousands of beds to hospital capacity and at the same time free up a number of existing beds. The FAO is saying in this report that it's skeptical that the Ford government will be able to meet its targets. But even if it does add 7,000 beds, for example, in the next few years, that'll still be short of what is needed by Ontario's population by 2027-2028. Similarly, on home care and long-term care, the FAO is saying in this report that even with all the measures the government's trying to take right now, they'll still fall short. The demand won't be met for long-term care beds and home care. And another key area of this report was on staffing and staffing shortages, particularly when it comes to nurses and personal support workers. Again, the government is taking steps to try and fill the existing vacancies, but the FAO is saying those vacancies plus the expanded need for these workers in the years ahead, it's quite likely there will still be a major shortage of these workers, like 33,000 short is what the FAO is predicting in this report by 27-28. Now, the FAO acknowledged in a news conference earlier that yes, the government is trying to address some of these problems, but with Ontario's growing population and an aging population, those initiatives and the spending they're planning just might not be enough.
They're trying to address the problem. And, and they have, there have been some significant policy moves made to try to address the problem. There has been some money spent to try to address the problem. In fact, this year, as we've noted in previous reports, the government's actually allocated more money to healthcare than even what we calculated they needed. It's the out years that we see the shortfall.
Now, he's not making any specific policy recommendations in this report. The opposition parties here at the legislature, though, they are reacting to this report and calling on the Ford government to spend more money to dip into the province's contingency fund and take other measures like dropping their court battle over Bill 124, which restrained the wages of nurses and other public sector workers. The Ford government today defending how it's handling healthcare and the amount of money that the government's spending on it, and also use this as an opportunity to call on the federal government to give the province more money.
This is the reason I kept saying over and over again, we can't do it alone. We need the federal government to support us. And again, I thank the government, the federal government, for the down payment. And we're pouring unprecedented amount of money. It's billions. And we're just going to keep working on it.
Now, Ford is referring to the recent agreements that the provinces have been signing with the federal government to increase the Canada Health transfer. The finance minister saying today Ontario didn't get as much as they would have liked, but they will continue working with the federal government to make investments. As for whether the government intends to change course at all, Premier Doug Ford making it clear that he thinks his government is moving in the right direction, he said, to address some of these problems within the healthcare system. Megan Fitzpatrick, CBC News, Toronto.